these droplets are so small that they can hang out in the air even after the person with the virus leaves the area. So that contributes to it being such a contagious virus, and the widespread transmission that we're currently seeing. People with COVID may not have symptoms, but they can still spread it. And for folks who do have symptoms, the symptoms can look like so many other illnesses, like cold or influenza, that it really does need to be diagnosed with a laboratory test. So one thing we'll be stressing throughout this presentation is that if anybody has any symptoms of COVID, or anything that could be COVID, then we really want you to go and get tested. And the incubation period, which is the period between when somebody is first exposed to COVID and when they become infectious and able to spread it to other people and ill, is about 2 to 14 days after their exposure. So symptoms of COVID-19, as I mentioned, some people may not have any symptoms and be what we refer to as asymptomatic. The majority of people have mild to moderate symptoms, and these are usually cold-like symptoms or allergy-like symptoms, flu-like symptoms. Some people do have very severe disease, and a lot of times this is people who have other health conditions, such as a weakened immune system, or they may be elderly, but people with no known health conditions can get severely ill as well. And then COVID-19 can be fatal and people can die. So, so really the full spectrum of illness is possible with COVID-19. And some common symptoms for those who are symptomatic could include a dry cough, a fever, shortness of breath, chills, headache, sinus symptoms similar to allergies. People say like postnasal drip or something like that. A new loss of smell or taste, gastrointestinal symptoms like nausea, vomiting, or diarrhea, and fatigue. So obviously some of these symptoms are a little bit more noticeable and some may be more mild. And so that's why it's really important to just really checking in with your families, with your staff, with your kids, and making sure that they're not having anything going on that's not normal for them. So this is some information from Sonoma County's COVID numbers, and they're a few days old, but the trends are going to be the same. So this is as of 11/13, and you can see that we had a spike of cases around August, and that kind of went down, but they're creeping back up again. So now is really the time to be vigilant and be prepared to experience COVID situations in your facility. And when we take a look at cases by age group, we see that young adults in this kind of 25 to 34 category have a high proportion of illness, but younger people are definitely getting COVID as well. And in this under 5 group, it may only be 3% of the total cases that we're seeing, but we're going to talk a little bit about why you don't want to be too reassured by that number. And so when we look at symptoms by age group, we're seeing here in the under 5 group and the 5 to 17 group that this kind of gray bar, which represents no symptoms, is relatively higher in these age groups than it is in adults. So a higher proportion of young children are not going to have any COVID symptoms, or they may be so mild that their parents didn't pick them up, and you know, something that they wouldn't have even thought of. And so that's why, again, it's really important to be in tune with how the kids and the staff are feeling, but also just to understand that most of the time it's not a question of if, but it's a question of when you're going to have a COVID-related situation in your facility, because you can do everything right and somebody can still have an asymptomatic infection. And that's why, you know, it's the best way to prepare for this is to do exactly as you're doing now, and really learn all you can about contact tracing and other mitigation measures. So our public health goal is to break the transmission chains to reduce illness and death. And if we look at this graphic, the dot on the far left represents one person with COVID-19, and say they give it to 3 other people who give it to 3 people. And you can see how that really grows, and it doesn't take long before you just have a really high number of cases. But if we can break links in this chain along the way, either by letting people know they were exposed to COVID, or people who are making these choices on their own, like social distancing and wearing a mask, you can really reduce the number of cases that you have. So that's why this is so important. And I'm just going to go over some terminology really quickly. A lot of times you hear these terms used interchangeably, but in reality they are slightly different. So isolation refers to a person who is currently sick with an infectious disease and could spread it to other people, and is keeping themselves away from others. And that's what we are talking about when we say isolation. So somebody with COVID-19 who is staying away from other people so that they don't spread it is isolated. When we say quarantine, we're talking about a person who was exposed to an infectious disease and is at risk of becoming sick and transmitting it to others. So a person who is exposed to COVID-19, again, could get sick in that 2 to 14 day period after they were exposed and spread it to somebody else. And as we have seen, they may not even have symptoms and may not know that they're sick and spreading it. So that's why this quarantine concept is really important, because they're kind of removing themselves from a situation where they're going to be around other people before they have the chance to infect them. And so that's what we say when we refer to quarantine: somebody who is exposed, who isn't sick yet, but could become sick and spread an illness to other people. And then sheltering in place, a lot of times you'll hear people who are talking about just kind of the general state of how we are as a society right now as being in quarantine, but it's slightly different. We don't know that we were necessarily exposed to COVID. So we don't know that we're necessarily quarantining, but there is a high risk right now that if we are very active in the community and interacting with a lot of people, we could be exposed. So sheltering in place comes in as this concept where we minimize our movement in the community to avoid a hazard. In this case, this hazard is COVID-19. So we're minimizing the amount of contact that we're having, the amount of time that we're spending outside of our home to avoid this hazard. So what is contact tracing exactly? And this is a process to identify people with likely exposure to COVID-19 and assess them if they're having symptoms now, help them get tested. We want to give them information so that they can quarantine and be that break in the chain before they get sick and pass it on to somebody else. And we also want to provide information and reassurance, because it's a scary thing to learn that you could have been exposed to COVID. So we want to help them to kind of navigate that. We want to give them some resources. Obviously, it can be a heavy burden to have to stay out of to watch your child if they're out of daycare for 2 weeks. And we provide referrals to resources like food banks that help them get through that quarantine period. I just got a note that my internet connection is unstable. Is everybody still able to hear me?
Yes, but you were kind of going in and out a little bit.
Okay, fingers crossed that it's not a forebearer of things to come. Okay, so let's go ahead and keep going. So we'll talk a little bit now about close contact. The CDC currently defines a close contact to somebody with COVID-19 as somebody who was within 6 feet of an infected person for at least 15 minutes total within 24 hours, starting from the 2 days before that person with COVID-19 started having symptoms, or if they didn't have symptoms, 2 days before the day that they were tested. So that 15 minutes total within 24 hours is a cumulative. So if you spent, 10 minutes with somebody in the morning and 5 minutes with them in the evening, that's 15 minutes of cumulative exposure. And then we also look at, in general with COVID, if it's a very brief interaction, like say you pass somebody in the hallway who has COVID-19, but don't really see them or interact with them any other time during their infectious period, that's not necessarily an exposure. But if something happens where you're coming into contact with their those respiratory droplets that we were talking about, like say you're walking past somebody and they sneeze in your face, that's a pretty significant exposure. So even though you may not have been around that person for 15 minutes, you had a lot of potential interaction with the virus. So that definition of 6 feet, 15 minutes is a starting point, but you also want to look at what was happening during that interaction. And then just something to remember is that in a childcare preschool setting, when we're looking at students and staff in closed cohorts, generally if there is one person who's positive, we're going to consider everyone to be a close contact, just because it's so likely that you will have met that criteria. And so when we go forward, we're gonna just kind of keep in mind that that one person in a cohort is gonna mean that everybody in that cohort is gonna be considered a close contact. If you do come across situations where there were exposures outside of the cohort, so say staff who are interacting with each other, like on a break or during drop off, if there are students, or not students, but kids in the same kind of holding area before they're escorted back to their classroom. So maybe exposed to folks who are not necessarily in the same cohort. That's when you want to look a little bit more at what activities were going on. So if you're doing something like talking, singing, eating when you're taking your mask off, exercising together, there's a lot of opportunities for you to expel those respiratory droplets from your body. You also want to look at the person's health. So somebody with a weakened immune system may be more vulnerable to getting COVID with an exposure that may not be as much of a problem for somebody with a healthier immune system. And we also look at whether the infected person had symptoms. If they were coughing and sneezing a lot, then there's more of those respiratory droplets coming out of their body and potentially infecting other people. And then we also look at the setting. Are you inside in a small stuffy room? Are you in a big room with the windows open? Are you outside? All of those things can affect whether the virus is hanging out around you or whether it has a lot of room to spread out and get blown away by the wind. And then we look at what I kind of call the big picture, and that's when you maybe don't have a good idea of whether you were around somebody for 15 minutes within 6 feet of them, but you want to think, is this a person that I run into a lot during the day? Is this somebody that I see regularly, that we usually chat for a couple of minutes here and there, we work together, you share a workstation, you share equipment or something like that, then that's probably going to constitute an exposure. And a lot of times it can be really hard to tease this out when it's not in a situation where there was a very clear exposure or it's outside of the cohort. And we want to stress that we are here as a resource to help you tease through those scenarios. So we want you to kind of know these concepts, but we are here to help talk through these challenging kind of gray areas. So again, when you do have exposure situations that are outside of the cohort, you want to kind of know, where was the person, who were they with, what were they doing. But again, if it's within the cohort, it's easier because everyone in the cohort is exposed. It's when we get outside of the cohort that we need to be asking more of these questions. And the infectious period is a really important concept when you are doing these investigations. So the infectious period is the time when somebody is sick where they could potentially infect other people. And with COVID, we consider this, if the person has symptoms, to be 2 days before their symptoms started through 10 days after their symptoms started, given that at day 10, they've had no fever for at least 24 hours without using medication to bring their fever down, and their symptoms have improved. For people who have no symptoms, then we use instead of the day their symptoms started, we use the day that they got tested. And this is the day that they had the swab performed and not the day that they had the test result given to them. So the day they went in and got tested, if they're positive, we go 2 days before that through 10 days after. So if a parent or a staff calls you and lets you know that either themselves or their child was diagnosed with COVID, and a lot of times you will learn about this before us, just because the parent gets that result, the staff member gets that result, and they call you right away and let you know, hopefully. And we don't necessarily get it reported to us that quickly. So a lot of times you may be the first person who finds out. So the first thing you're going to want to ask them is, okay, did the person have symptoms? If they did, when did that start? And then you're going to count back 2 days before that and say, okay, was the child in school those two, or at preschool or daycare those 2 days before they started having symptoms? And if the answer is yes, then you know that you have a situation where you're going to have to do this contact tracing and contact investigation. And if the answer is no, they were not at your facility within those 2 days, then you know that you don't have that risk of exposure. So again, that's really the importance of the infectious period, is it lets you know what time you need to focus on. And it also lets you know, for anybody who was exposed, when do they have to start quarantining. So again, quarantine is removing yourself from situations where you could expose other people during the incubation period of your illness. And for COVID, that incubation period is 2 to 14 days. And so as soon as somebody is notified that they were exposed to COVID, they need to start their quarantine through 14 days. We're going to talk a little bit about testing, and these concepts can be confusing. So if you don't, it's not quite making sense as I'm explaining it, that's okay. A lot of times, you know, you need to talk it through a few times before it really starts to click, but we just kind of want to plant that seed so that when these situations do come up, you're like, oh yeah, I remember hearing something about that. So we'll recall that the incubation period for COVID is 2 to 14 days. And if you have a situation where you're hearing about a child or a staff member who had contact with somebody with COVID-19 outside of your facility, so for example, another household member, ideally they're going to get tested twice. The first time is right away, and that's so that it can help you make decisions about whether there's been an exposure at daycare. So if the child gets, say it's a child gets tested right away after their exposure and they're already positive, then you know that if they were at daycare during that infectious period, then you need to move forward with a contact investigation and with closing the cohort for those 2 weeks. But if they get tested and they're negative, then you know that they're not going to have been that exposure. The child's going to be removed from the group setting while they quarantine, and even if they do develop COVID later in their quarantine period, it's going to be out of that time period when they could have been at your facility and infectious. And then the second time that we want them to get tested is near the end of their quarantine period. And that's so that, say they, that incubation period is 2 to 14 days. So say their infection becomes active and they're able to spread their illness later in that quarantine period. They get tested around day 10 or 12. So that you know when they come back into the group setting, they are not going to have an asymptomatic infection that they can then spread to other people. So again, we recommend, when you have those situations where somebody was exposed outside of the childcare preschool, that we want them to get tested right away, and we want them to get tested again at the end of their quarantine period. So now we are going to talk a little bit, it sounds like you should have received some guidelines that we put out recently for kind of if this, then what scenarios that you may encounter with COVID-19, and we're gonna go over them briefly. So, and if you haven't received this, then we can get it to you. So these are kind of some, and I'm just going to look at the chat real quick because it looks like, okay. Okay, so we'll just kind of go over this guidance. So in these, we have a few different scenarios here. A child or staff has symptoms of COVID-19, send them home and recommend testing. You can keep the cohort open. Child or staff has close contact with somebody who had confirmed COVID-19. Again, what we talked about, send them home with instructions to quarantine for those 14 days after exposure, recommend testing again right away, which is down here in this footnote, and a second time 10 to 12 days after their exposure or sooner if symptoms develop, but you can keep the cohort open given that first test was negative. And then if they have COVID-19, if they had a positive test and it's a student or a staff member, here's what we want you to do. We want you to give us a call or an email, have them stay home right away, and then go through identifying the close contacts, which we'll be talking a little bit more about. And again, in a cohort setting, it's easy because it's the whole cohort. And then this is some return to school criteria or return to work for staff. So say that somebody is excluded for one reason or another, when can they come back? So if a child or staff member is having symptoms, they go and get tested, it's negative, or they go and see their doctor and their doctor diagnoses them with something else, then you're just going to want to follow whatever your normal illness policy is for when they can return. And some examples are no fever for 24 to 72 hours without using medication to bring the fever down, or no nausea, vomiting, diarrhea for 24 to 72 hours without using medication to hide those symptoms, that they're well enough to participate in routine activities or any other criteria that you have, or if they have a doctor's note, whatever conditions are specified in the doctor's note. Let's say they have symptoms of COVID-19, they have not been tested, and they have not received a diagnosis from their doctor. That's a situation where there's a chance the person could have COVID-19, but if they don't get tested or they don't get evaluated, you're not going to be able to confirm that. So what we recommend in that situation is that you have them stay out as if they could have COVID, which will cover the worst case scenario in which they do have a COVID infection that we're not going to pick up because they're not getting tested. So that means they're out for 10 days. They've had no fever for 24 hours and their symptoms have improved. And a lot of times in that situation, if a parent or staff member is really hesitant to get tested and you as the provider says, well, you either get tested or you can stay out for 10 days, that may motivate them to get tested instead. So we really recommend that. And then obviously we want them to stay home while they're waiting for their test result. And then if they have a positive test, again, they're gonna stay home until they meet that criteria, that 10-day criteria for coming back. And a note that if they get if they have a confirmed COVID-19 infection, a doctor's note does not override this criteria for 10 days having passed in symptoms and being fever-free for 24 hours and symptom improvement. So even if, say the person feels great 5 days into their illness and they talk to their doctor and their doctor says, yeah, you can go back to childcare, you can go back to work, you can't accept that. They need to follow this criteria. And so just be aware. Hopefully that's not happening too often, but in the instance that it does, just be aware that a doctor's note does not override these criteria. And then as we discussed a little bit, if a child or a staff member has had close contact with somebody with confirmed COVID-19, they need to stay home for that 14-day quarantine. We recommend they get tested twice, once right away and once before returning. And if they don't want to get tested before coming back, then we again recommend that you treat it like that person could have developed a COVID-19 infection on day 14 of their quarantine, so they need to stay out for 10 more days. So we have 14 for quarantine plus 10 for isolation, which is 24 days total. And that covers your bases, and making sure that you're not having a child or a staff member come back to the setting with an asymptomatic COVID-19 infection that could potentially spread to other people. And again, if you decide to require this and let your families and your staff know, this, in our experience, is motivating to have people go out and get tested, which could shorten the length of time that they need to be out of work or childcare. And again, if you do, this is a site information gathering tool. So when a parent or staff member calls you and says that they or their child has COVID-19, this is the information that you want to collect. Again, we want you to give us a call so that we can help you, but we are going to ask for this information. So please be prepared to give us this information when you give us a call. It helps us help you much more quickly. So have a stack of these handy next to your phone. And then when you do have somebody with COVID-19, we have this template letter. This is the one that we really want you to send out to anyone who you identify as a close contact to a case. So anybody in the same cohort, it lets them know that you recently were exposed to a person who tested positive for COVID-19. It gives them information about what they need to do to quarantine, and who they can contact here at Public Health if they have more questions. And so this is really important information to get out.
Lindsay, I'm going to interrupt real quick just to address, we're seeing a lot of questions already pop up in the chat. Thank you for sending those, and we're tracking them all, and we'll be answering them in the last portion of the presentation. So feel free to keep them coming, but we do have time reserved for it, and we will be addressing them. So thank you.
Thanks. And then these last couple of letters, these are ones that you can send out if there's a situation where there's a lot of anxiety in cohorts that maybe aren't affected. If you do have a cohort that did have an exposure for COVID-19, but there's a lot of anxiety in non-affected cohorts, this is some information that you can send out. And similarly, if there's anxiety surrounding a situation in which you had to exclude somebody who was exposed outside of daycare to COVID-19, but there's still questions and anxiety, these are some template letters that you can send out. This one is the one that we really want to be sent out to anybody who was exposed. And then the other letters are, again, if you know how best to communicate with your families and your staff. And so those are some options if there is a lot of anxiety surrounding a situation and you want to provide some reassurance. So we're going to go ahead and talk now through some real life scenarios that you may come into contact with, and what we would do in these situations. And we're going to
Thanks, Lindsay. Yeah, thanks for presenting all that information, Lindsay. And we understand that this is a lot of information, and it's we don't expect everybody to understand all this right from the get-go. So feel free to contact us and ask us questions. But these guidelines will hopefully help to figure out what to do in many situations. So if we can go back to the PowerPoint, Lindsay. So now that we've gone through the guidelines, we thought we'd present some scenarios to put the guidelines in active practice. And these scenarios correspond to the scenarios within the guidelines as well. Are you able to get back to the PowerPoint, Lindsay?
Are you seeing it?
Thank you. Yeah, okay. Now I see it. Thank you. Okay, so a child comes to daycare with a new onset of runny nose, but is otherwise doing well, happy, eating well, and has no fever. And the parent insists that it's just because it's cold outside, because of changes in the weather or the temperature. What do? Do you allow them to attend school? This child should be tested for COVID-19 and have a negative result or an alternative diagnosis made by a healthcare provider before returning to the center. As Lindsay discussed, any new onset of symptoms, even if it's mild allergy symptoms or a new runny nose, can be COVID-19. Children can have very mild symptoms, and 20 to 40% of people have no symptoms at all. So as you all know, this is a very common scenario. It's very common, especially this time of year, for children to have a little bit of a runny nose. And if it weren't the era of COVID-19, a mild symptom like that would not be so concerning. But given the era that we're in right now, any symptom like that can be due to COVID. And so it needs to be investigated and acted upon. It's important to note that this cohort would be able to stay open. We just need to isolate the child, have the child stay at home, and get tested before we decide what to do next. Keep in mind also that in children, COVID-19 may only last for 1 or 2 days. But the same virus can be fatal in someone who's elderly or who has other medical conditions. So we need to identify, isolate, and test these kids to reduce the spread and potentially save lives. Many centers also have household or family screening questions or parental screening questions to make sure that nobody else in the household has symptoms. It's a good idea to have this and ask the family members in your households, because of course anybody in the household who picks it up from somewhere in the community can pass that on to the child, who then can bring it into your center. So the more that you all educate your family members that they need to take these symptoms seriously, keep the child at home, test anybody who has symptoms, then the better the chance of not introducing it into your center. Okay, next slide, please.
Do you want me to jump back to the guidelines and take a look at?
Maybe we'll do that at the end.
Okay, sounds good.
Okay, so the child was not tested, but the doctor said it was hand, foot, mouth. Can this child return? And the answer is yes. So if a child has an alternate diagnosis that's made by a healthcare provider with the note to document, then that child can return. But the child can't return without a definitive alternate diagnosis. Can't return if the provider felt that it was just a cold and didn't need to have testing done, because as we've discussed, that could be COVID-19. So it would be helpful also for you to inform your family members that they need to try and press the provider for a specific diagnosis. And they need to identify something. And if this can't be done, then the child needs to be tested or kept at home. Okay, next slide, please. So the family does not want to test the child. Now what do you do? So this brings up a lot of questions. There are some strategies that might be helpful in trying to encourage the families to do testing. And here are some examples. So you can discuss the testing process with the family. Many centers, including our testing center at the county, will allow a throat swab rather than a deep nasal swab, which is easier on kids. It's the same swab that we do for strep throat. The child can, of course, sit on the parent's lap for comfort. They can have something to eat or drink immediately after for soothing. And keep in mind that the importance of testing is similar to the importance of vaccines. It's uncomfortable momentarily, but it's important in keeping the child and others in the child care and preschool safe. So if parents still decline, the child needs to stay home for 10 days because we're assuming that they might have COVID. And they need to be fever-free for at least 24 hours, up to 72 hours, without using any medication like Tylenol. And they have to show significant improvement in their symptoms before returning. Symptoms don't have to be completely gone, but the hard criteria is that the fever has to be completely gone for at least 24 hours and possibly more if you're comfortable with that. But as long as the symptoms are significantly improving, then it's not worrisome. And if parents are still declining, well, pre-COVID, the standard was that you can't let somebody back if they have fevers over 101. However, now we know that low-grade fevers can be part of COVID. So even a low-grade temp is something to be concerned about. And we're advocating keep them home for about 72 hours, fever-free, not even a low-grade temp, as that may be the only symptom for COVID. So now we'll take a look at the guidelines to become more familiar with them. So if you could switch back, Lindsay. And so the scenarios that I've presented correspond to scenario number 1, where the child or staff has symptoms of COVID-19. So as we discussed, send them home, recommend testing, encourage them to get testing. The cohort remains open, but make sure that they follow social distancing, hand hygiene, facial coverings. And then depending on what the outcome of that test is, we'll decide what to do next. The second page of the guidelines shows the return to school criteria. So if they have a negative test or an alternate diagnosis, then, as we discussed before, you can follow the standard illness policy, meaning no fever for 24 to 72 hours without use of medication, no nausea, vomiting, diarrhea for 24 to 72 hours without medication, active, playful, eating well, and well enough to participate in the routine activities, and any other criteria that you deem important. So that's a pretty straightforward case. Now for the other situations. So we can go to the scenario number 2 next, and Needham is going to present. Oh, sorry, there was one more. So a child gets tested, feels great, back to normal, but no result back yet. So can this child return to daycare? And the answer is no. So we need to keep the child home until the test result is available, and they can only return if the result is negative. Next scenario.
Okay, so I'm going to be talking about situations where children or adults in a cohort become contacts, or somebody within that group becomes a contact of a confirmed positive COVID-19 case. So I'm going to use a situation here, which many of you may have encountered. A child attends daycare Monday through Friday with a closed cohort. The child's grandparents often help care for the child at home because his parents work. On a Friday, the grandfather picks up the child from daycare, and the child spends the evening and overnight at the grandparents' house before going home on Saturday. On Sunday, Grandpa discovers that he feels, mild symptoms of maybe he has a cold or something. He decides to get tested for COVID-19 just to be safe. And meanwhile, this is on Sunday evening, meanwhile, the child goes back to school on Monday, and Grandpa gets his test results on Tuesday and finds out that he does have COVID-19. So he immediately calls to inform the daycare. So this child, you can go to the next slide, Lindsay. This child has been exposed to a positive COVID-19 case while they were infectious. And now this child is at school. And what should the daycare provider do when they learn that this child was actually exposed to COVID-19? Do they need to close the cohort? No. So this child should definitely be immediately removed from the cohort and isolated from other people until they can get picked up, and until hopefully they'll be tested and we can determine if they actually are positive or not. In the meantime, the cohort can remain open. So hopefully, you can go to the next one, Lindsay. Hopefully this child would be tested immediately, which is what the daycare provider is going to recommend. In this case, we'll imagine that the parents agree to get the child tested. After a couple days, they get the test results back. The child has tested negative, so that we know the cohort is not exposed. But can the child now, with this negative test result, return to daycare? And the answer to that question is, again, no. Even though the child got a negative test, they have to remain in quarantine for 14 full days, because anytime during that 14 days, they could develop COVID-19. So while the daycare cohort can stay open and we know that the children there were not exposed, this child was exposed and does have to complete their quarantine at home for 14 days. Okay, and next one, Lindsay. So there's another situation that can happen with children a lot, which is that even though the facility would strongly recommend that the child be tested, the parents don't feel comfortable getting the child tested, or they refuse to have the child tested. So in this situation, when would the child be able to come back to daycare? And secondly, should the cohort be able to stay open? So yes, we know that the child was exposed to COVID-19. We don't know if the child has COVID-19 or not. So whether they can come back to the cohort remains no, because they have to complete their quarantine for 14 days. The rest of the children at daycare were exposed to a contact of a positive case. So they are what we call contacts of contacts. So in this case, even though the child didn't get a negative test, we know that the cohort can remain open because we just can't confirm that the children in the cohort have been exposed. Okay, so now we have this child who's been in quarantine for 14 days, or is about to be finished with quarantine for 14 days, and the teacher or the director of the program is requesting they get a second COVID-19 test. maybe they didn't have the first one, so they're requesting a second time that the child be tested at the end of their quarantine period. So this child, what their daycare is asking for is for the child to have a negative test to be able to return to the cohort. So is it necessary for parents to get the second test? And here's the response. The best response is for the parents to test the child at maybe day 10 or 11 or 12 of their 14-day quarantine period. Because if it's this late in the quarantine, we're going to hope that the child won't develop COVID-19 in the last 2 days. And so if they test negative at this time, they can just finish their quarantine and then return to school. But again, some parents will decline to test the child. So in that case, the child would then have to complete their 14 days of quarantine, and then we would have to assume that they may have become a positive case during those 14 days, and they would have to isolate at home for an additional 10 days. So in this case, if people are not willing to test at the end of quarantine, it is the prerogative of the care provider to require a total of 24 days of quarantine before they allow that child to come back to the cohort, just to keep their cohort safe and to protect the school. Okay. And we're going to move on now to Maya, who's going to tell us about when we actually have a positive case within the cohort. Oh,
Did you want to point out just which?
Sure. Yeah, we'll take a look at the guidelines. So in this case, we're looking at number 2 here. A child or staff has symptoms.
We're at the bottom.
Sorry. Oh, sorry. Yeah, down here. A child or staff has had close contact with someone who is a confirmed COVID-19 case. So this child is going to stay home for 14 days since the last time they were exposed to the positive case. Even if the child or staff gets a negative test during this 14-day quarantine, they still have to stay home for the full 14 days. After the 14 days, they've had a negative test, they can return. If the child, oh, this is tricky. Okay, this is great. If the child continues to have contact with the positive case, like say this child has to keep staying with their grandparents because mom and dad work, so grandpa has COVID-19, but the child continues to be exposed to grandpa. For the 10 full days that grandpa is in isolation, maybe he has to stay at grandpa's house, maybe the child keeps on sneaking into grandpa's room to play checkers, who knows what. But he continues to be exposed to COVID-19. So that, in this case, the child's quarantine period is not going to begin until the last day of grandpa's isolation or infectious period. So that would be, again, a 24-day quarantine away from childcare or away from, being around other people. Okay.
Okay, I just want to encourage everybody to take a big deep breath, let it out. This is so much information, and we totally understand that, you're not going to get it all from this presentation. And like Lindsay said, we're here to support you. We want to be able to answer questions, and each situation is going to feel a little bit different. And so one thing I would encourage is not tonight, but at another time when you feel more relaxed and you have some quiet time to just look at the guidance, really read it through, think about what situations might arise or be relevant to your situation and where they fall into that guidance, and then think about what you would do and how you would communicate it. And then call us and we'll help you answer questions. So the scenario that I'm going to go through is actually the most straightforward. It's if a parent calls you and lets you know that their child tested positive for COVID. So what are you going to do now? And obviously this would be the same if it was a staff member, a teacher that was interacting with the kids. But for this example, we're going to talk about if a child tested positive. So when we were looking at the guidance, part of that guidance is that site information gathering tool. So we would really like you to utilize that to collect all that information prior to contacting us. So you're going to need to probably reach out or call the parent again and ask some questions, because we really want to know when those symptoms started, And then again, if they didn't have any symptoms, we want to know the day that they had the test done, because that's going to help you figure out if there was an exposure at the school. And then once you've collected that information, you're going to get in touch with us. So you can call us or you can email us, and the links for that contact info are in the guidance. Like Lindsay was saying, probably you as the provider are going to have this information before we do. So there's a couple steps that need to happen when someone gets tested before public health is notified, and you may know first. So you have a really important role to play here in terms of stopping the spread. Really, you're in a really powerful position to help us, and that's, we want to be able to work together with you. So your first job is to make sure that the family understands that the child needs to be isolated, cannot return to school or go anywhere for at least 10 days. If you determine that there has been an exposure at the school based on those, the 2 days before the symptoms started or the 2 days before the test, then as Lindsay mentioned, you're going to identify that whole cohort and anybody that might have interacted with the child as close contacts. We're going to ask you to be in touch with those families and explain to those families that their children are now quarantined. Public health will definitely reach out to the positive case. We may not be able to reach out to all the contacts. It's really going to depend on how many there are, and moving forward how our county is doing. So part of what we're asking is for you to do some of that contact tracing for us. And what that means is you're going to be in touch using that letter that's in the guidance, so you can email it, whatever is the best way to get it to your families, to let them know that their children who were in that cohort are now identified close contacts to a positive COVID case and need to quarantine. One thing that we want to make sure that they understand, and it is in that letter, so you don't have to remember everything, but we want to make sure that they know that they can't send their children to an alternate caregiver during that time. So the child needs to be at home. Ideally, there would be one designated caregiver that would quarantine alongside the child, particularly, I'm assuming, with this age children, right? So they need a caregiver to be around all the time. So the rest of the family can go about their normal activities. They should try to stay separate from the close contact, the child in the cohort. But one parent would probably need to stay home with them, not go to work. And obviously every family situation is a little bit different. It's not always going to work, but if it does, that's the recommendation. And just the SoCo emergency website has a lot of good info, so please feel free to use that. There's some good videos on there that explain quarantine and isolation. So those are good resources for you and for your families. Okay, so I think we talked about this a little bit. How do, did I go through that already? Yeah. Okay, so you can go to the next slide. And so then how do you know when the child or the staff who was positive can return to daycare? Public health is going to help you with that. So most likely they are going to be assigned to a case manager who will be in touch with them and will be able to provide them with a clearance letter that clears them to return to school. But so the criteria for them to return is that they have to meet all three of these. So it's been at least 10 days since they first started feeling sick, or the day they got tested if they didn't have any symptoms. And we call that day 0, and then we count forward 10 days, and that 10th day is their last day of isolation. So the following day, they're cleared, as long as they haven't had a fever for the last 24 hours and they're not taking any medication that would bring the fever down. And if they did have symptoms, those symptoms have improved. So they don't have to be completely gone. A child might have a lingering cough, maybe a little, still a stuffy nose. But we want to see some symptom improvement in whatever symptoms they did have. And I know there's a lot of questions. So.
Okay. So we have so many questions coming through the chat. I think we're going to start with all the questions from the chat before I open it up to anybody else to raise their hand and speak aloud. We will go ahead and get started with that. And when
Ashley,
we finish,
do we want to answer the questions that were received before the presentation?
yes, let me pull those up for us now.
I'm going to answer that question that I saw pop up while you're doing that, just because
Okay.
the person that just asked if you can, you're cleared more quickly if you are COVID positive than if you were in quarantine. And the answer is yes. And that is very counterintuitive and I think confusing sometimes. So the people that are in quarantine longer than the person, most likely longer than the person that is COVID positive.
Okay, so Jenny is working on translating the questions into questions and answers into Spanish right now. So Jenny, why don't you pop onto English whenever you're finished translating that question that was just answered, and then I'll ask the next one.
Hi, Ashley, can you guys hear me?
Yes.
Can you repeat that question for me, please?
The one that I just answered, Jenny?
Yes.
Yeah, so the question was, is the person that is COVID positive in isolation for a shorter amount of time than a person that is quarantined? And the answer was yes. People who have COVID isolate for a shorter amount of time than the contacts who are in quarantine.
Okay, let me translate.
Yeah, thanks.
Done.
Okay. So the next question is a person carrying active virus as long as the person continues to feel ill?
I'll answer this one. So it goes back to the question of when is one done with their isolation? So if one is COVID positive, then within 10 days, they should no longer be contagious. And the reason is that the viral load drops significantly by 10 days. We know that from viral studies. So by 10 days, by the 11th day, one should be presumed to be not contagious anymore, even if one still has some mild symptoms. The caveat to that is if somebody has other issues, if they have an immunocompromised condition or they've been on steroids for possibly COVID pneumonia, those are special situations. And in that case, it may take up to 20 days before they're cleared, but that's something that their doctor would clarify for them. So yes, you could still have some lingering symptoms, but as long as it's been more than 10 days and those symptoms are improving, then you would no longer be contagious.
Okay, I'll wait till I hear back from Jenny to move on to the next one.
Would it help if we started answering some of the questions in the chat if we can?
Okay, just finished that one.
Okay. Yeah, I mean,
We could,
I'm not sure how then it would be, someone would need to translate it again.
Right, right.
So,
Well, I'm just worried that we're not going
I
to be
know
able to
it
get through
takes
them
a
all.
long time to do both. Jenny, if you put your video on, we could just see when you're done talking and
Yeah,
go
I can
about
do
it
that.
that way, or
Whatever works best.
why don't you just put your video on, and that way you don't have to worry about bouncing back and forth.
Yeah, and I'll just give you a thumbs up.
Okay, sounds good.
Mhm.
All right. I think just in case people jump off, probably the number one question is if they're able to contact you all specifically. Are we able to share your email addresses, or do you just prefer that people contact the number on the guidelines? What's the best way to get in touch with everybody here?
The number on the guidelines is the best way. It's that 565-4566, and then the email is phnurse@sonoma-county.org. And those emails are routed to us just because not everyone is working on the same day. So that's the fastest way to make sure that it gets to those who are working with schools and daycares.
Okay, so phnurse@sonoma-county.
.org.
I can type the phone number.
Okay, so the next question was, when a person holds a public related job, should they have a test to determine they are still positive before returning to their job, rather than just following the 10-day after testing positive?
Oh, no. So if somebody has tested positive, there's no need to do another test. And that's because the test may continue to be positive for up to 90 days. But again, we know that after 10 days, the infectivity has dropped so much that one would not be contagious to others. So even in nursing facilities, even in skilled nursing facilities with elderly people, if nurses or LVNs are going back to work, the recommendation is not to test after 10 days. So you can feel confident that it should not be contagious after that point.
Ashley, does it work to just get started on a second question and then we can, because it's on two different channels, so I think we'll just have to catch him
Okay.
up on the question.
All right. So the next question is wondering if you have any guidance about families' holiday plans and vacationing and traveling and returning to school after that.
I believe the guidance is, that the real issue is not as much the traveling, but the gathering with lots of people that are outside of your usual bubble. So I believe, and Ermi, correct me if I'm wrong, that when people return from holiday travel and have been visiting with, family and friends that they're not usually in contact with, that we are asking them to quarantine for 14 days, correct?
That's correct. Unless they're absolutely 100% sure that they wore a mask every time they were with somebody who was outside of their household, and there was plenty of ventilation. I mean, there are a lot of stringent criteria that would need to be met for one to not quarantine. But given how the cases are rapidly increasing throughout Sonoma County and in California, the wise thing would be to quarantine and then test towards day 10.
And public health did just come out with a guidance around the holidays that I know Ashley has shared through the constant contact through 4Cs. And we can send out again to all providers to help communicate and remind your parents to be thoughtful around the holidays, of course.
Okay, those are all the ones that I have that were sent ahead of time. So we can go ahead and.
Thought there was a mask one.
I thought there was a.
Well, I'll just say the thing that we were talking about, which was are masks required for children at childcare facilities. So the county strongly recommends the use of masks for anyone over the age of 2, but childcare facilities, it's not required for children younger than 12.
Thank you. Yes, that one got lost
Yeah,
in my inbox.
I can imagine.
So Maria, can we go ahead and get started with the questions from the chat?
Yeah, so I have one that says when a child care has 3 siblings and one of them tests is positive, can the other 2 children return to the care when they tested negative?
So that is a situation, and I'm going to go back to the guidance to take a look at that one. Those two, the children, if there are 3 children and one of them tests positive, then the other siblings are going to have to stay home and quarantine for 14 days. But if we look at this, this scenario here at the bottom that Megan was talking about a little bit, where if the person has ongoing close contact with the person with COVID-19, so say it's really not possible for those siblings to be separated, they're going to continuously be exposed. So their quarantine is going to start when the sibling who was positive finishes their 10-day isolation, and a negative test done during that time is a negative test done right away will let you know that there wasn't necessarily exposure in the sibling cohorts, but they still need to complete their 14 or 24, depending on whether they can be isolated from the sibling. They need to get a test result. And again, we recommend that they get tested once in the beginning and once at the end of their quarantine, but a negative test and not let them end it any sooner.
So Lindsay was cutting out a little bit there, but just to, this is a strange situation because in this case, the child who tested positive could have COVID, go through their 10 days, and then be released and be able to go back to school, while the siblings may still have another 14 days of quarantine from that point if they never did test positive for COVID.
And Maria, you can go ahead and just keep going. Jenny will catch what she can, just so we can keep moving since there's so many questions, and everybody can, I'll make an announcement at the end just to remind everyone that they can call that number and send an email if they have questions that weren't answered tonight.
Okay. What about inconclusive or potentially positive tests? If retested and new test said negative, can that person return?
That's a tough one. You want to
We're
take
all
it?
quiet.
Usually, if there's an inconclusive test, it means that there is some viral particle there, but it's not high enough that the something called the cycle threshold has not been reached. So typically, if it's indeterminate and it's repeated, it ends up being positive. Tough situation. I don't know that I've ever seen that it's indeterminate and then negative subsequently. That's a situation that one would have to run by one's regular doctor and contact us. We'll have to look at the whole situation, see who might be positive in the household, what the timing is of exposure, et cetera, et cetera. That's a complicated one.
So if a staff tested positive, we at the preschool can remain open?
That's going to depend. If there are multiple closed cohorts that don't necessarily have interaction with one another, then only the affected cohort would need to close. But if it's a small setting where there's only one group, then everything would pretty much need to be shut down for those 14 days.
Can people contract COVID more than once?
I'll take that on. I think we don't know yet. I think there have been a few cases that we've seen where that has happened. They're few and far between so far. We're learning more all the time. When Dr. Shende referred to the recommendation not to test people within 90 days of being positive, part of that is what we know so far is that people have not contracted COVID again during that 90-day period.
Yeah, but beyond 90 days, they can turn positive. And in that case, we consider it a reinfection. We still have a lot of research to do to see how infectious they truly are.
And where can they access the guidance for scenarios and template letters?
So I sent that out to our entire provider list today. We don't always have everyone's most up-to-date emails. So I think Melanie is going to try and find the link. I only have PDFs. I don't have the link right at my
I found the one
now.
for the holiday. I'll go back
Okay.
and now look for the other one.
Okay,
Is it
Melanie
on
will
the
post it in the
public
chat. But you can always reach out to me and I can send you what I sent earlier today too.
And we
I'll
do
put
plan on
my
putting
information.
it on our website, but it's not there yet.
Oh, then I wouldn't be able to find it. I might be able to.
Don't look for it on the website.
Okay. So we'll send it again. The guidance will come out, but I also posted, like I said, the holiday recommendations that we were talking about from Public Health. That's on the SoCo emergency site, and then now it's in the chat as well.
If a parent tests positive and during the first 14-day quarantine for a child, a second parent tests positive, do we then add 10 days from the second positive case for quarantine of the child?
I think the answer is going to be yes, unless there's some way to guarantee that the child was isolated from that second parent, which my guess is going to be the answer to that would be no. But if there are multiple people in the house who are getting COVID back to back, whoever doesn't have it is going to need to quarantine for 10 days after the last person had it. So that's a situation where if you would be released from isolation or quarantine sooner if you actually had COVID. And so we would probably want to talk about when is the best time to do a test in that situation to have the least amount of the time that a person could have to be excluded. But yeah, if there are multiple people in a household with COVID, then whoever doesn't get it is going to need to stay quarantined for 14 days after isolation ends for the last person who had it.
What about if the whole family contracted COVID? what would the quarantine period for them be?
If everyone in the household had it, then they would all just need to do their 10-day isolation period. And once somebody ends their 10-day isolation period, they don't need to quarantine again after that. So if there's other family members who are still undergoing their 10 days, somebody correct me if I'm wrong, but they wouldn't need to keep quarantining. Everyone would just be in that isolation category when they're staying home for 10 days.
That's right. So the first people who had COVID could be cleared from isolation, can go back to work or to school, while others are still in isolation at home.
Okay, runny nose, you mean one time of needing a tissue, or maybe after 2 times of needing a tissue? That is what we are doing. Seriously, I need a tissue after going into the cold in the morning.
1 or 2 times, no. But if there's a new runny nose that has started that day and it's a consistent runny nose, then that's considered a symptom.
Will a doctor's note clear the child's return, or will the health department have to clear his or her return?
If we're talking about a COVID positive case, then the public health department will provide a clearance letter for the child to return.
Okay, and can a doctor write a note that the runny nose is due to allergies, or must the child be tested?
Again, that goes back to whether this is new or not. If this is a doctor who knows the child very well and can, it depends on many things. If it's springtime and allergies are beginning, that's one thing. If it's December and all of a sudden they're starting to have allergies, that doesn't make sense. So it needs further discussion with the physician and a clear letter from the physician explaining why they think that it is allergies.
If any symptoms present and a negative test result occurs, is it assumed that it was not COVID, even though flu and COVID can be present together?
Generally, if somebody has symptoms and has a negative test result, then we would assume that something else is going on with them. A scenario where, I mean, if it's something like they're in the same household as somebody with COVID and they are having COVID symptoms and they had a negative test result, that might be something that needs some more conversation. But if they didn't have any known exposure, it's cold and flu season, they're having respiratory like cold and flu symptoms and they get tested for COVID and it's negative, then we can go with that result and assume that something else is probably going on.
If a child tests positive, doesn't the whole household and all the contacts have to isolate and quarantine and not go to work?
Correct. So the positive case is isolated for that 10-day period. Anyone that is a close contact is quarantined for at least 2 weeks, and depending on their ability to separate from the positive case, it may be longer. But yes, the family, anyone that's had close contact is quarantined and should not be going to work or school.
Okay, so can you return faster if, oh, I think that one was already answered. So can you return faster if you have COVID than someone who is isolating due to being exposed?
Yes, the answer is yes. If you have positive COVID, you isolate for 10 days. If you are a contact of a positive COVID case, you have to quarantine for 14 days.
And can you give us advice on how to tell parents a doctor's note doesn't override criteria for return to daycare?
I would say you can make us the bad guy. You can say, sorry, public health, you know, you can blame it on us. We'll take the heat.
So, and if a question comes up, who can they contact? And on taking the next steps, do they need to contact 4Cs or licensing, or who are they able to contact?
We're going to ask them to contact us for sure. I'm not sure if they need to report to their licensing agent, but if so, then licensing as well. If they have the guidance and this, you know, answers to questions will most likely come from public health rather than licensing.
Yeah, I think licensing will want to know if you're going to be inactive for any period of time, and so does 4Cs, so we don't send you any more referrals or anything like that. We like to know if you're open or closed, and if there's anything we can do to support you at that time too. So it never hurts to let us know so we can do what we can.
Okay, and can we get downloadable letters?
The template letters are part of the guidance, so you should have access to those if you have the guidance.
And they want to know if all this information and the slide, is it available to them, and if it's available in Spanish?
We do have the slides available in Spanish that we weren't able to do like a split screen to share them along with the Spanish interpretation today, but I can send it out to anybody who is interested. I mean, I'll just send it out to everybody, English and Spanish, so everybody has it, just like I've been doing.
And I believe we're working on getting the guidance in Spanish as well. Is that true, Maya?
We've
Yeah,
got
we
it.
actually have it. It's
Oh,
finished.
good.
Do you have? Yeah, you have it, Ashley.
Yeah,
Okay.
I sent that out this morning, but if for some reason you're not getting the 4Cs emails, just contact me and you'll get it. Or I'll give it to you.
And is the testing free? I called for information to my doctor, and the representative told me charges might apply if tested.
Testing at the county is free. Not sure about other private sites. That depends on their guidelines.
Do they again call the same numbers to get those free tests, or?
Yes.
And I think there's particular sites that are available. Maybe we can help put those out as well.
Yeah.
Yeah, that was an additional question. Where can they find testing centers?
Yeah, if they call the same number for public health, we can get that information. And in fact, we're working on trying to get a scheduling program online so that eventually people can schedule their own tests. It's not available yet, but for right now.
No,
just
I
call
think
them.
it actually might be. I Googled it today and it looked like you could go on and schedule your own test at this time.
Hot off the press.
Yeah, if you go to SoCo emergency testing, that should take you there.
Okay, is it possible to get a false positive COVID result? If it is, if it's possible and we have a child in care or family member that lives with test positive and then negative all within 48 hours, which do we follow?
Good question. False positives are rare. They can happen. It's a little bit more common if it's a rapid test. That being said, if we have a positive and then a negative, we go by what's safest, which is to assume that it's positive and do isolation, because again, the goal is to try and prevent the spread.
And as a provider, if I leave the country and when I return, do I have to quarantine myself for 14 days? And do families and parents that also leave the country, do they have to do the same?
The answer is yes.
And how many times a day should we take children's temperature?
If you take it, some places take it upon arrival, and after that, I would say only if you have reason to think the child may have a fever. But if they're otherwise seem fine, then there's no need to take it multiple times a day.
Okay. We have had runny noses and congestions, no fevers, and required 72 hours symptoms free, but did not require testing, and children are back to school and symptoms have not returned. Should they get tested or do we move on?
It depends at what point their symptoms are. If this is something 2 weeks ago, then just move on. If it's just happened in the last day or two, then it's advisable to get tested. So it kind of depends where along the situation of the illness you are.
And there's another one. I'm assuming it's for testing. It says where at the county, and can you please share the number?
Melanie just posted the number again. I can also make sure it's included in a follow-up email to every single attendee. They'll get an email from Zoom as a follow-up tomorrow, and I'll put the contact information in there. That way everybody's got it at their fingertips.
So
Also-
one thing that I would say is that I think, so if there's a positive case in your facility, then we are gonna recommend that everyone be tested. If they can be tested through their healthcare provider, that's great. If they need assistance, then public health will help them. I don't want people to just start calling that number and saying they need to schedule a test, because that's not really the right channel. So let me see if I can find the link to the SoCo emergency website testing info and put it in here.
Great. I'll include that too, and I'll include information to
I think I just found it. I'm going to post what I found on SoCo
Okay.
emergency, if I can get into the chat again.
And how long are test results taking?
Now the county test results, usually the positives are coming back in about 48 hours, maybe a little longer, but sometimes shorter. And negatives are taking a little bit longer usually than the positives, but usually not taking more than about 3 or 4 days.
Perfect, Melanie. Thank you.
Okay, and that was all the questions for the chat, but there is a few people that have questions, and I believe they want to do it live since they don't have access to a chat.
Sure.
Okay, so I've got one. So if you are on and let me make sure. Okay, Jenny, you're available. So if you are calling in on the telephone, you can use *9 to raise your hand and let me know that you have a question. And then *6 to unmute yourself. Otherwise, anybody here who wants to ask their question, just use the raise hand feature on Zoom and I'll see you and allow you to talk. So Lugarda Coria, I'm gonna go ahead and allow you. You can go ahead and unmute yourself. Just your hand is raised if you have a question.
Have to unmute.
Yeah, she's got to unmute herself too.
Yeah.
Or can you unmute her?
No, I can only ask to unmute her.
Oh, okay.
So
I might be able to. Wait, hold on. No.
Jenny, I don't know if you're able to. If she's on your channel. Otherwise, anybody else while we wait? Did you see any more, Maria? I only see that one hand raised on my end.
Yeah, I think that might be the only one.
Okay, well, I have her contact information, and we can reach out to you to find out what your question was if you're not able to unmute yourself.
So, yeah, there's a lot of thank yous in the chats. That's really, yeah, we're happy to do it. Thank you so much to our public health crew here tonight. I did want one clarification just for childcare providers as employers. Of course, the recommendation is if someone is traveling during the holidays to get them tested before they return to work or a child returns to the program. But do be careful with that and check in with whoever you're connecting with on business practices, because you may, if you're an employer and you require that, you may have to pay for that test if you require that of your employees. Now, the county does have the free testing sites, and I believe you can actually coordinate it for your employees if you want to do that. But I think there's a certain number you have to have available to be able to coordinate for your site itself. So do check in with that about business practice, your HR type thinking, if you're going to require it of your employees before they return to the work site.
And you're speaking of if the recommendation is for them to quarantine for the 2 weeks and then test at the end, right? So you can't just get off a plane and take a test and have it be negative and go back to work, right? Because that's not how it works.
Well, as an employer, we've been told from our attorneys that we cannot dictate what our employees do outside the office or outside their work environment. And what we can make them continue to follow all the guidelines of self-screening and symptom tracking and things like that. But if we choose to require a negative test before they return to the office as an employer, then we would have to pay for that.
Got it. I just wanted to, I don't know if we spent too much time talking about this, but the timing of testing is really important. So we don't want people to go out and get tested too soon. And this might be an example of when that might come into play.
So if someone does travel and they come right back to the site, then you're saying really it wouldn't help to test that first day back anyways. There's very possible that they could still have a positive.
Exactly.
Yeah.
Because there's that 2 to 14 day incubation period. We want people to wait at least a week, if not 10 to 12 days, and you'll see those numbers, that 10 to 12 days in the guidance. But just as sort of a general way to think about it is, you know, it has to be incubating for a while before you turn positive. So if you get a negative test too soon, it doesn't really give you good information.
Yeah. So really good is to remind your employees of the guidance that we put in the chat about safety during the holidays, and hopefully keep to those small groups and not too much travel.
Okay, I think that wraps everything up. I don't see any more lingering questions. Oh, one more as employers. What about wages if someone quarantines? You're fine, Sandra. I don't know if this is a question they can answer or not. I don't know.
There is requirements of employers that as an employer, you have to provide those 80 hours up till December 31st as an employer, additional time. But definitely that is something to check in with. We can look into who the right people to check in with, but I think it's something you have to, it's not a public health question. It's your legal as an employer, but there is some requirements where you have to pay, and then there's time where they can take sick time, vacation time, and they have their FMLA rights as well. So we need our HR people here with us tonight for that question.
Okay, thank you everyone so much. Thank you for bearing with us in the beginning as we navigated our first Zoom webinar with live translation. Thank you so much, Jenny, for doing your absolute best in getting this information through to people in Spanish. Everyone have a good rest of your night, and my email address, you probably are sick of getting emails from me, so I'm sure you have it. So let me know if you need any follow-up, any way I can help. So thanks again. Good night, everyone.
Thank you.
Good night.
Good night.
Good night. Thank you, everyone. How do I